Contraceptive patches are a form of hormonal birth control that is applied directly to the skin to prevent pregnancy. The patch is a small, adhesive square typically about 1.5 inches by 1.5 inches that delivers a steady dose of estrogen and progestin, the same hormones found in many oral contraceptives birth control pills. These hormones are absorbed through the skin and into the bloodstream, helping to regulate the menstrual cycle and prevent ovulation. How contraceptive patches work. Hormonal regulation. The contraceptive patch releases synthetic forms of estrogen and progestin into the body. These hormones work in three main ways to prevent pregnancy. Inhibition of ovulation. The patch prevents the ovaries from releasing an egg ovulation. Without ovulation, there is no egg available for fertilization by sperm. Thickening of cervical mucus. The hormones also cause the cervical mucus to thicken, making it more difficult for sperm to swim through the cervix and reach any eggs that might be released. Thinning of the uterine lining. The patch thins the lining of the uterus, making it less likely for a fertilized egg to implant and develop. Usage schedule. The contraceptive patch is typically worn on the skin for 1 week at a time for 3 consecutive weeks, followed by a patch-free week, the 4th week, during which the user usually experiences a menstrual period. The cycle then repeats with a new patch applied after the patch-free week. Application sites. The patch can be applied to several areas of the body, including the buttocks, abdomen, upper outer arm, or upper torso, except the breasts. It should be placed on clean, dry skin, and in a location that is free of cuts, irritation, or excessive hair to ensure proper adhesion and hormone absorption. Advantages of contraceptive patches. Ease of use. The patch is easy to apply and only needs to be changed once a week, unlike daily oral contraceptives, making it a convenient option for those who have trouble remembering to take a pill every day. Steady hormone delivery. It provides a steady release of hormones, reducing the risk of hormonal fluctuations that can occur with daily pills. Non-invasive. It is a non-invasive method of birth control that does not require any insertion or medical procedures. Improved menstrual cycle control. Many users experience lighter, more regular periods and reduced menstrual cramps. Disadvantages and considerations. Skin reactions. Some users may experience skin irritation or allergic reactions at the application site, such as redness, itching, or rash. Hormonal side effects. The patch may cause side effects similar to those of other hormonal contraceptives, including nausea, headaches, breast tenderness, mood changes, and weight gain. Effectiveness can be reduced. The patch may be less effective in individuals weighing over 198 pounds 90 kg, as hormone absorption can be affected by body weight. Effectiveness of contraceptive patches. When used correctly and consistently, the contraceptive patch is about 99% effective at preventing pregnancy. This means that less than 1 out of 100 women will become pregnant each year if they use the patch correctly. With typical use, which accounts for human error such as forgetting to change the patch on time, the effectiveness may drop to around 91%. Who should use contraceptive patches? The contraceptive patch may be a good option for people who prefer a simple, easy-to-use birth control method and do not want to use daily pills, injections, or devices like IUDs. It is suitable for those who do not have a history of blood clots, stroke, or other conditions that may be exacerbated by estrogen use. The patch is a suitable choice for individuals who want reliable, reversible contraception that allows for a quick return to fertility once the patch is no longer used. Usage instructions. Start of use. The patch is typically applied on the first day of the menstrual period or the first Sunday after the period begins. The user continues to replace the patch on the same day each week for 3 weeks. Patch placement. Apply the patch to clean, dry skin on the buttocks, abdomen, upper outer arm, or upper torso, but not the breasts. Press firmly for about 10 seconds to ensure it adheres properly. Change weekly. Replace the patch every week for 3 weeks, applying a new patch to a different area to avoid skin irritation. Patch-free week. After 3 weeks of use, remove the patch and have a patch-free week, during which the user typically experiences withdrawal bleeding similar to a period. Restart cycle. After the patch-free week, apply a new patch to begin the cycle again. Conclusion. Contraceptive patches are a convenient, easy-to-use method of hormonal birth control that provides effective prevention of pregnancy when used correctly. They are an ideal choice for individuals seeking a non-invasive, weekly contraceptive method that avoids the need for daily pills. However, users should be aware of potential side effects, risks, and the importance of correct and consistent use to maintain effectiveness. Consulting a healthcare provider is important to determine if the contraceptive patch is the right choice based on individual health needs and lifestyle. Thank you for watching my video. Please subscribe my channel.